Welcome back, my people. We are still talking about treatment for viral gastroenteritis. And before we continue, I always start by appreciating you people for the good job you are doing. This involves commenting on my videos, sharing, and subscribing. So for those who have not subscribed, let's continue subscribing and make this channel grow bigger and bigger. And for those who have already subscribed, just feel appreciated. So let's get back to our point of discussion, whereby we will continue with the treatment available for viral gastroenteritis. And in the treatment, the main focus is to prevent dehydration, because as we have discussed above, complications which come about as a result of dehydration may be so dangerous. For example, brain swelling, it might be so dangerous. So when you are managing or treating viral gastroenteritis, the main aim is to control dehydration by drinking plenty of fluids. In severe cases, hospitalization or hospital admission and intravenous fluids may be necessary. Depending on the situation, you may need to be hospitalized or admitted, and intravenous fluids may be necessary. For example, if you are vomiting, you can't drink a lot of fluids, so intravenous fluids will be necessary. Over-the-counter oral rehydration solutions, for example, ORS. Also, Pedialyte can be helpful in mild cases. So that means in mild cases, you can use over-the-counter medications like Pedialyte or ORS to help in rehydration in mild cases. These solutions are easier on your child's stomach. That is, they don't bring more stomach disturbances. So these solutions are easy on your child's stomach and contain a balanced mixture of water and salts to replenish essential fluids and electrolytes. Let me repeat this point. These solutions, the ORS or the Pedialyte, are easy on your child's stomach and contain a balanced mixture of water and salts to replenish essential fluids and electrolytes that you have lost or your child has lost through diarrhea and vomiting due to viral gastroenteritis. A point to note: these solutions are available at local pharmacies and don't require prescription, but you should follow the instructions carefully. The instructions are always printed, or there is always a pamphlet showing the instructions on how you can reconstitute or mix these solutions. So if you are opt to use the over-the-counter oral solutions like the Pedialyte and the ORS, make sure, and before you give your child, you follow the instructions on the pamphlet. Another point to note: antibiotics have no effect on viruses. They can only have an effect on bacteria. So antibiotics have no effect on viruses. Check with your physician before taking over-the-counter medications. If you have to take an antibiotic, make sure you check with your healthcare provider or the doctor, and he or she will advise you on the best way to go. Let's talk about treating diarrhea and vomiting. Diarrhea can be treated in adults with over-the-counter drugs or medications such as loperamide or Imodium or bismuth subsalicylate, also called Pepto-Bismol. A point to note: your doctor may also prescribe probiotics to replace the healthy bacteria that lost during diarrhea, or they may prescribe medications to treat severe vomiting. So, your doctor might decide to prescribe probiotics to replace the healthy bacteria that you lost during diarrhea, or they may prescribe medications to treat severe vomiting. What should you eat and what should you not eat? What should you eat and what you should avoid during this time whereby you are recovering from viral gastroenteritis? What food should you eat and what food should you not eat? In other words, what food should you eat and what food should you avoid? As you start to feel better and reintroduce food into your diet, it's better note this, it's better to reintroduce foods into your diet, and it's best to opt for a blend of foods such as the following. Let me repeat this point. As you start to feel better and reintroduce foods into your diet, it's best to opt for blend of foods such as number 1, rice, which is easily digestible, potatoes, toasts, bananas, which are rich in potassium, apple sauce. These foods are easier to digest and don't cause more stomach upset. You know, there are foods which you might take, and instead of recovering, you introduce another problem in your stomach. So these foods are easy to digest and don't cause more stomach upset. What are the foods you should avoid? So avoid the following foods till you get better. Number 1, fatty fried foods, or food with a lot of fats, or fried foods. Number 2, caffeine. Number 3, alcohol. Number 4, sugary foods. And the last one, dairy products. For example, you might find if somebody takes milk, most of the people react with dairy products. You might find that if you take milk in an empty stomach, most of the people end up diarrheaing. So you should avoid dairy products because they might worsen the situation. And this marks the end of our discussion today. Tomorrow we will continue tackling the same topic because it's a longer one, but we are almost winding up. So let's continue joining our aunts as one family. We continue subscribing, liking, and sharing our videos. Let's meet in the next video.